Have you ever wondered what the symptoms of prostate cancer are? It's a question that is often overlooked, yet it's of paramount importance, particularly for men as they journey through the later stages of life. Prostate cancer is more than just a health issue. It's a growing concern that has left an indelible mark on society. It's a silent adversary, often revealing itself when it's quite advanced. But it doesn't have to be this way. Understanding the symptoms, recognizing the signs, and seeking timely medical advice can make a world of difference. It can change a diagnosis from being a life-altering event to a manageable condition. So let's shed some light on this subject. Let's talk about prostate cancer, delve into its symptoms, and understand what it truly means. Because knowledge is power, and power is the first step towards prevention. In this video, we will discuss the various symptoms of prostate cancer. Before diving into the symptoms, let's understand what prostate cancer is. The prostate is a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. It's an integral part of the male reproductive system. But like other parts of the body, it's not immune to the development of cancer. Prostate cancer begins when cells in the prostate gland start to grow out of control. It's often a slow-growing disease, initially confined to the prostate gland, where it may not cause significant harm. However, while some types of prostate cancer grow slowly and may need minimal or no treatment, other types can be aggressive and spread quickly. Now, how common is prostate cancer? It's actually the second most common cancer among men worldwide. Certain factors may increase a man's risk of developing prostate cancer. Age is one significant factor. It's rare in men younger than 40, but the chances rise rapidly after age 50. Family history also plays a part. If a man has a father or brother with prostate cancer, he is more likely to develop it himself. Geography seems to play a role too. Prostate cancer occurs more often in North America, Northwestern Europe, Australia, and on Caribbean islands. It's less common in Asia, Africa, Central America, and South America. The reasons for these geographical differences are still being explored. And finally, race. For reasons not yet determined, prostate cancer is more common in men of African ancestry, and it's less common in Asian American and Hispanic Latino men. A word about lifestyle factors. While it's not proven that diet and obesity can cause prostate cancer, men who eat a lot of red meat or high-fat dairy products and consume fewer fruits and vegetables may have a slightly higher chance of getting prostate cancer. Now that we have a basic understanding of prostate cancer, let's move on to its symptoms. Prostate cancer can be silent in its early stages. It's a chilling thought, isn't it? The idea that a disease as serious as cancer could be developing inside your body without you even realizing it. But that's often the reality with prostate cancer. In its initial stages, the symptoms can be so subtle that they're easy to dismiss. One of the most common early indicators is a change in urinary habits. This might mean finding yourself heading to the bathroom more often than usual, especially at night. Now, this can be caused by a variety of factors, such as aging or even just drinking a lot of water. But if you notice that you're urinating frequently and it's not due to any obvious factors, it could be a sign that something's not right. Another symptom to watch out for is discomfort or pain while urinating. This can feel like a burning sensation or even just a general feeling of discomfort. Again, there are many possible causes for this, including infections or other non-cancerous conditions. But it's still worth bringing up with your doctor, especially if it's accompanied by frequent urination. You might also notice that your stream of urine isn't as strong as it used to be, or you may find that you're unable to completely empty your bladder. These are symptoms that something could be blocking your urinary tract, and one possible cause for that is a growing prostate tumor. Additionally, you might experience difficulty in getting an erection or erectile dysfunction. This could be due to the prostate tumor interfering with the nerves that control erections. However, it's important to note that these symptoms can also be caused by other health conditions unrelated to cancer, such as heart disease or diabetes. While these symptoms can be alarming, they don't always mean cancer. However, it's important to take them seriously. Don't let fear stop you from seeking help. If you're experiencing any of these symptoms, it's crucial to talk to your doctor. They can help you figure out what's going on
and guide you towards the next steps. Remember, catching prostate cancer early greatly improves your chances of successful treatment.
As prostate cancer progresses, it can exhibit more severe symptoms. At this stage, the cancer may have spread beyond the prostate, affecting nearby organs or even distant parts of the body. This advanced stage of prostate cancer might manifest in various ways, and it's vital to understand these symptoms to seek timely medical intervention. One of the most alarming signs is hematuria, or blood in the urine. This may be accompanied by a burning sensation during urination or increased frequency in the need to urinate. It's crucial to remember, though, that while these symptoms could indicate advanced prostate cancer, they could also be symptoms of other medical conditions, such as urinary tract infections or kidney disorders. It's essential to consult a healthcare provider for an accurate diagnosis. Persistent pain or stiffness in the lower back, hips, or upper thighs is another symptom to be wary of. This discomfort may be due to the cancer spreading to the bones, a common occurrence in advanced prostate cancer. The pain might be constant or intermittent, but either way, it should not be dismissed as mere aging or overexertion. Perhaps one of the most subtle yet concerning signs is unexplained weight loss. This is a common symptom in many types of cancer, not just prostate. A sudden loss of weight without any changes in diet or exercise habits might indicate that the body is fighting against the cancer. This symptom, coupled with a loss of appetite or general fatigue, should prompt an immediate visit to the doctor. In addition to these, other symptoms, such as difficulty in maintaining an erection, weakness, or numbness in the legs or feet, or loss of bladder or bowel control due to cancer pressing on the spinal cord, might also be observed. Remember, having one or more of these symptoms doesn't necessarily mean you have prostate cancer. Many of these symptoms can be caused by other health conditions. However, if you're experiencing any of these signs, it's vital to consult with a healthcare provider. Early detection and treatment can significantly improve the prognosis. These symptoms require immediate medical attention. If you or a loved one is experiencing these symptoms, it's crucial to seek medical advice. This statement is not to be taken lightly. Prostate cancer, like any other health condition, can be managed effectively when diagnosed early. But how exactly is prostate cancer diagnosed? One common method is through prostate-specific antigen, or PSA, testing. This is a blood test that measures the level of PSA, a protein produced by both normal and malignant cells in the prostate. High levels could potentially indicate the presence of prostate cancer, but it's important to note that elevated PSA levels can also be caused by other conditions, such as an enlarged prostate or a prostate infection. If PSA levels are high, doctors often recommend a prostate biopsy to confirm the presence of cancerous cells. This procedure involves removing small samples of prostate tissue and examining them under a microscope. Once a diagnosis is confirmed, the next step is determining the stage of the cancer. This could involve imaging tests like CT scans or MRI to see if the cancer has spread beyond the prostate. The stage of the cancer will inform the next crucial step: treatment. Now let's delve into the various treatment options available for prostate cancer. These choices are as diverse as the individuals facing them and depend on several factors, such as the stage of the cancer, the patient's overall health, and personal preferences. Surgery is one of the most common treatments. Known as a prostatectomy, this procedure involves the removal of the entire prostate gland and some surrounding tissue. It's often the go-to option for men with localized prostate cancer. Radiation therapy is another prevalent treatment. It uses high-energy rays or particles to kill cancer cells. There are two main types of radiation therapy: external beam radiation, which is given from a machine outside the body, and brachytherapy, where small radioactive seeds are placed directly into the prostate. Chemotherapy, often used when the cancer has spread beyond the prostate, uses drugs to kill rapidly growing cells, including cancer cells. It can be administered through a vein in your arm, in pill form, or sometimes both. Then there's hormone therapy, designed to stop your body from producing the male hormone testosterone, which prostate cancer cells usually need to grow. And finally, there's also the option of active surveillance, which is often chosen for slow-growing prostate cancers. This involves regular checkups and tests to monitor the progression of the cancer, with the decision to intervene if the situation changes. Remember, early detection is key in the successful treatment of prostate cancer. So don't shy away from regular checkups. These could be the difference between a treatable condition and a life-threatening one. Stay informed, stay vigilant, and stay healthy. While we can't completely prevent prostate cancer, certain lifestyle changes can reduce the risk. Let's delve into some of these preventative measures. First and foremost, maintaining a healthy diet is crucial. You've probably heard the phrase, "You are what you eat," and in many ways, it rings true. Eating a balanced diet rich in fruits, vegetables, and whole grains can contribute to overall wellness and may lower the risk of prostate cancer. Studies suggest that a diet high in red meat or high-fat dairy products might increase a person's chances of developing prostate cancer. Therefore, it's wise to limit these foods and lean towards a more plant-based diet. Another key element in the prevention equation is regular exercise. Physical activity not only helps maintain a healthy weight, but also can lower the risk of certain diseases, including prostate cancer. Exercise doesn't have to be a grueling marathon or an intense weightlifting session. It can be as simple as a brisk walk in the park, a quick swim, or a spin on your bicycle. The important thing is to make it consistent and enjoyable. Remember, the goal is to keep your body moving and your heart pumping. Lastly, regular checkups play a significant role in prevention. Prostate cancer, like many other diseases, is easier to treat when detected early. Routine screenings such as prostate-specific antigen (PSA) tests can help spot any irregularities or early signs of prostate cancer. These checkups should be a regular part of your healthcare routine, especially if you're over the age of 50 or have a family history of prostate cancer. To wrap things up, prevention isn't about living in fear. It's about making healthier choices and being proactive about your well-being. It's about taking control of your health and making decisions that support a long and healthy life. Remember, every step you take towards a healthier lifestyle, no matter how small, is a step in the right direction. These steps may not guarantee complete immunity from prostate cancer, but they can certainly stack the odds in your favor. Proactive steps towards a healthier lifestyle can make a significant difference. Prostate cancer is a serious health issue, but with awareness and early detection, it can be managed effectively. As we conclude our discussion today, let's take a moment to recap the key points we've covered. We began with an understanding of prostate cancer, a disease that primarily affects men, usually over the age of 50. It's a condition that starts in the prostate, a small gland that produces seminal fluid. While it's a slow-growing cancer, in some cases, it can be aggressive and spread quickly. We then delved into the early symptoms of prostate cancer. Often in its initial stages, this disease may not present any symptoms at all. However, some men may experience changes in urinary habits, difficulty starting and maintaining a steady stream of urine or blood in the urine. These signs should not be ignored, and medical advice should be sought promptly. As prostate cancer progresses, the symptoms become more pronounced. Advanced symptoms may include bone pain, weight loss, and fatigue. It's important to remember that these symptoms can also be associated with other health conditions, so it's crucial to consult with a healthcare professional for a proper diagnosis. Next, we discussed the diagnosis and treatment of prostate cancer. A diagnosis usually involves a series of tests, including a prostate-specific antigen test, digital rectal examination, and potentially a biopsy. Once diagnosed, treatment options vary, ranging from watchful waiting for slow-growing cancers to surgery, radiation, and chemotherapy for more aggressive forms. We also explored prevention and lifestyle changes that can reduce the risk of prostate cancer. A balanced diet rich in fruits, vegetables, and whole grains, regular exercise, maintaining a healthy weight, and regular checkups can all contribute to a healthier life and lower the risk of developing this disease. Remember, awareness is key. Knowing the potential symptoms and risk factors can lead to early detection, which significantly increases the chances of successful treatment and survival. It's crucial to have open conversations about prostate cancer, to dispel myths and misconceptions, and to encourage men to seek medical advice if they have any concerns. And finally, it's essential to remember that while prostate cancer is a serious health issue, it is not a death sentence. With modern medical advancements, many men live healthy, active lives following a prostate cancer diagnosis. It's about understanding the disease, recognizing the signs, and taking proactive steps towards prevention and early detection. If you found this video informative, please subscribe to our channel for more health-related content. Remember, knowledge is the first step towards a healthier life.